Pues muy buenas tardes, bienvenidos todos los que nos acompañan en persona y los que lo hacen vía remota. Y también hoy es una ocasión muy especial, tenemos la visita del doctor Renzo Guinto, quien ha estado trabajando temas de salud planetaria y según exploraba yo con el grupo ahorita, es una visita más que oportuna porque como que hay mucha actividad en este tema aquí en el instituto. Y estamos tratando de aumentar un poco la coordinación entre los grupos. Entonces, una actividad de este tipo puede ayudar mucho a aglutinar. El doctor Eduardo Lascano, por otro compromiso, se disculpaba de no poder acompañarnos en esta sesión y me pedía dar la bienvenida al doctor Guinto. Realmente me la puso difícil porque me pidió dar una introducción y cuando vi su cápsula biográfica, pues no hallaba ni por dónde empezar. Realmente ha tenido una trayectoria impresionante. Él inicialmente hizo grados, obtuvo su grado de médico en la Universidad de Filipinas, pero después obtuvo el grado de doctor en salud pública en la Universidad de Harvard y todavía recibió entrenamientos adicionales en Oxford, la Universidad de Copenhague y en Hawái. Pero más allá de su trayectoria, digamos, académica, estudiantil, pues él ahora funge como profesor asociado y director fundador del Programa de Salud Planetaria y Global del Centro Médico y del College en San Luke, en Filipinas, ¿no? Entonces, desde ahí ha empezado a darle mucho impulso al tema de salud global y él ya venía, salud global y salud planetaria en especial, y él ya venía trabajando como jefe del Programa de Salud Planetaria y fue cofundador del Centro Sunway de Salud Planetaria en Kuala Lumpur. Entonces, va cubriendo cada vez más terreno en el planeta. Hawái, estudió en los Estados Unidos, Inglaterra, actividad en Kuala Lumpur. Él ha trabajado como consultor en diversas organizaciones, destaco nada más su trabajo en la Organización Mundial de la Salud, pero también dos cosas clave, ha sido miembro de 5 comisiones Lancet relacionadas con salud planetaria y funge como editor de Lancet Planetary Health, una revista de la familia de Lancet, que ha sido especialmente importante para dar visibilidad al tema de salud planetaria. Y bueno, por último, además de los múltiples reconocimientos y contribuciones a su trabajo en salud planetaria, él cuenta con más de 150 publicaciones, pero algo que llama la atención en su cápsula es que ha desarrollado una serie de videos de difusión. Entonces, más allá de la actividad académica, mi sentir es que el doctor Renzo también pues busca incidir en distintos públicos, ¿no? Entonces, realmente nos complace mucho tenerlo con nosotros hoy. Le damos la bienvenida, doctor, y dejaría el espacio pues para que nos platique un poco del trabajo que ha hecho en salud planetaria a nivel global y especialmente en las Filipinas y en el sureste de Asia, ¿no? Bienvenido.
Muchas gracias, Bernardo, and thank you very much to the National Institute of Public Health. While I was listening to you, I was just nodding because I know very little Spanish. I know you've heard I come from the Philippines, which is a country that has a very strong and long historical relationship with Mexico. And both of our countries were former colonies of Spain. And while many countries in Latin America, including Mexico, were taught the Spanish language by the Spanish conquistadors, unfortunately, the Philippines were not taught Spanish. But there were many Spanish words that were incorporated into our language. So I know what is la mesa, zapatos, ventana, cuchara, tinidor, but I can't construct a straight Spanish, sentence. So I was just nodding to you, hoping that all the things that you were sharing to them are good, right? And not the bad things about Dr. Renzo. But kidding aside, again, I'm very grateful to be here. I flew all the way from the other side of the world to be here in Mexico. And I'm here for, a meeting, a Lancet Commission meeting that just finished yesterday. And then I thought, I'll already be emitting a lot of carbon crossing, the Pacific. And so might as well make the most out of this trip. And I can't ignore visiting the National Institute of Public Health. Of course, a special thanks to Dr. Juan Rivera, who 2 years ago he and I were in the same Zoom panel at the International Conference on Urban Health. And we liked each other during that panel. We exchanged emails. We followed each other on Twitter. And I promised him that when I return to Mexico, this is my second time here, I will make sure I'll come to the National Institute to meet you in person, but also to hear about the amazing things that the Institute is doing. And I'm also very grateful to the meeting that we had a while ago, and there's so much potential for collaboration. So it's hard to give a lecture about planetary health to an organization that has a very strong baseline knowledge of planetary health, because usually I'm invited to speak in many parts of Asia, even in Europe. There are some major universities across the world that are seeking my advice on how to establish a planetary health group, because that's something that we've done in Southeast Asia for the past 3 years in the middle of a pandemic. And we've established, as you've heard a while ago from Bernardo, not just one, but 2 centers, programs of planetary health, and more are yet to come. So it's very exciting, a very exciting time for Southeast Asia. And I hope you can also visit our tropical islands in the other side of the world. So here I'm going to share a bit of the updates, what's happening in our region. I'll start with some introductory remarks about planetary health. I know for some this is not new, but I understand there are also other colleagues from different centers here in the Institute that might be hearing about planetary health for the first time. So I'll just make sure we're all on the same page. And then towards the end, I want us to talk about the future, right? The future of planetary health and how we can bridge both the Philippines and Mexico, both Latin America and Asia. So, and the way to start is to, again, commemorate, and to remember this long-standing relationship. For 3 centuries, Acapulco in Mexico and Manila in the Philippines were connected by these trade route, we call it El Galeon de Manila. I understand there's another Lanao de China, right? And this really enabled the transfer, the trans-Pacific transfer of goods, from, the coconuts from Asia, I believe were brought here, and then all the other products from Mexico and Latin America brought to the Philippines, China, the rest of Asia. This is what was happening, hundreds of years ago. And I think in this day and age, we need to revive these relationships, not merely economic, but perhaps scientific, okay? And something that will really, try to bring together our collective brain power to solve the seemingly intractable challenges of planetary health. And I think it's not going to be very difficult because our 2 countries have lots of similarities. We're both predominantly Christian Catholic nations. The Philippines is the only Catholic country in Asia. We have, same interest, we have lots of similar nature and natural landscapes, touristic spots. You have Cancun, we have Boracay, you have lots of beautiful mountains like the Tres Marias, and we also have our own Cordillera. And we have the same passion for beauty pageants. I'm not sure if any of the people here are fans. In the Philippines, it's big. When it's Miss Universo, it's a national holiday. And it's always a battle between the Filipina and the Colombiana and the Mexicana and the Venezuelan candidate. So, there's so much beauty in our 2 countries. And of course, our shared love for boxing. So I'm sure, you've seen this in the news. It's either the Filipino or the Mexican winning, right? And I think while we love boxing against each other, now is the time to box together against, as I mentioned a while ago, the shared challenges at the nexus of human health and the planet's health. So of course, all of our countries, Mexico and the Philippines included, have just survive and is still wrestling, grappling with a still ongoing pandemic, and of course there are emerging challenges, obesity. I just learned a lot about the efforts of Mexico in really putting obesity control and prevention at the heart of health policy. Our country has so much to learn from you on that regard. But the Philippines has a long-standing experience in disaster risk reduction and management. Our country is visited by around 20 typhoons each year, but now the number is growing, and also the intensity of these calamities also worsening. And then, of course, air pollution. Manila and Ciudad de Mexico, both are big cities with many challenges being faced regarding pollution, not only to the air, but also water. And so we're both confronting the challenges of rapid urbanization as well. So we're all facing these, waves of COVID, but also, as you can see in this caricature, we should now begin being much more concerned, perhaps, about not just future waves, but future tsunamis of climate change and biodiversity collapse and all their myriad health consequences. And I will not go into the details of this diagram. I'm sure, especially the Planetary Health Group have seen this diagram, how our health in this epoch of the Anthropocene, meaning it's not anymore a natural phenomenon, but it's human activity that is shaping the face of the earth, how our health is being shaped by all of these forces. Urbanization, continuously increasing population growth, migration, our patterns of consumption and production, and technological advancement, among others, leading to a wide range of ecological damages that eventually impact the health and well-being of our populations. And so, as a Medico, as a physician, I always remind my medical students in St. Luke's, in this day and age, in the 21st century, we are now treating not just one type of patient, but two kinds of patients. On one hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus. But on the other hand, you also have Mother Earth, and I believe in Latin America, you even call Mother Earth Pachamama, right? Is that the same thing also in Mexico? It's more of, in Latin America, but in the other countries. But we have this deep regard, right, for Mother Earth, and she herself is wearing a face mask, of course, not to be protected from SARS-CoV-2, but to be safeguarded from the myriad ecological damages that we are inflicting on her as a result of our irresponsible human activities. And so that really, for me, is, planetary health, and I'm sure some of you are already exposed to different definitions, different proposed definitions of planetary health. But for me, it's just very simple, right? We now have two patients, people and planet. We can't keep on treating sick people living on a sick planet, okay? And of course, this is the definition of planetary health in the 2015 report, The Health of the Human Civilization and the Natural Systems on which it depends. In our discussion a while ago, you also, Dr. Rivera reminded us of a more elaborate definition of planetary health. In that same report, it's the achievement of the highest level of health, right? In an equitable and sustainable manner by addressing the human systems, the social systems that created these problems in the first place. And this is really, part of the public health community's realization that over the past century, we've been adding 25 to 30 years to the average life expectancy of the world, unfortunately, at the expense of the planet. We've been putting food on the table to improve the nutritional status of our communities at the expense of our natural ecosystems. We've built cities that, expanded socioeconomic opportunities for people, healthcare access, among others, at the expense of natural ecosystems, because we've been impinging on wildlife, on biodiversity. And so this manifesto published, I believe in 2014, really cemented why the public health community must now be talking about not just about the health of people, but also the health of the planet. And now I'm starting to think, will there be a time when the National Institute of Public Health will be renamed as the National Institute of Planetary Health, right? That's a provocation. And, again, this report in 2015 really kind of conveyed the message, we need a new discipline in this epoch of the Anthropocene, because our medical toolbox, our public health toolkit, they're not anymore sufficient and adequate to address these complex challenges faced by the human civilization and the planet on which our health depends. So I'm borrowing this diagram from Howard Fromkin, who is one of the fathers of planetary health. I'm happy to have a conversation on this, but at least, and I'm agreeing to this, planetary health is somehow this opportunity for a grand convergence for all these different frameworks, paradigms, concepts, disciplines that we've been seeing, exposed to. A while ago, I was asking how the National Institute is navigating this space of many different frameworks, the One Health framework, the eco-health approach, and then now you have planetary health, global health as well, Salud Mundial. And for me, this is an opportunity for us to just come together and put all our energies and disciplines and talents and resources, because at the end of the day, we have a common goal of healthy people, healthy planet, healthy animals and plants, all creatures, great and small, living in greater interdependence and solidarity. And I'm also reminded by this quote by Anthony McMichael, who is one of the epidemiologists who, shed light to the linkage between climate change and human health. He wrote this, this is quote from an article that he wrote in the early 1990s. And what he said was that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda, which now I think is what we now call planetary health. So it's, planetary health is not like a shift, from public health we shift to planetary health. For me, planetary health is just an expansion of the public health agenda, because now we're including a major part of our health that we've excluded for nearly a century, the health of the planet. And then if you go down, it also says we need an ability or create or enhance our ability to collaborate with unfamiliar disciplines such as climatology and ecology. I wonder, in the National Institute, do you have climatologists and ecologists and veterinarians maybe, or maybe entomologists working, right, in this amazing institution? And I always remind my medical students, by the end of your med school, by the time you graduate, you should have at least 5 new friends who are not medical doctors. Right? And at least maybe one of them should be an economist, another an ecologist, maybe an engineer, maybe a lawyer, and maybe even a priest. Because many of the planetary health problems that we're facing are fundamentally ethical, philosophical, spiritual. These are opening new questions, right, about our broken relationship with Mother Earth, with nature. So yeah, I think Anthony McMichael was quite prophetic about planetary health. He already said it 30 years ago, and now, we have this new field, sector, discipline, and paradigm. But also, I always remind colleagues, planetary health, yes, it might be the first time you're hearing this phrase, but it's not a new invention. What we need is to just go back. What we need to do is just to go back to indigenous wisdom, to ancient wisdom, bodies of knowledge, to indigenous communities. And what we will realize is that this idea that the health of the people and the health of the planet are inextricably intertwined and inseparable, this has been existing for millennia. Okay? And unfortunately, it's science and it's even medicine and public health that has been diverted to another direction. And now we're being called to return to this age-old wisdom that you can't separate the health of the people from that of the planet. According to Chief Seattle, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. Very planetary health, right? Whatever we do to the planet, the impacts will just come back to us in the form of human disease, despair, if not death. So, and foundational to the planetary health concept, and I'll not go into the details because we had a really good discussion this morning about the planetary boundaries, or at least we've touched on it. The way I teach this to my medical students, if we have, infant mortality rate, life expectancy, maternal mortality rate, etc., as indicators of the health of the population, this is how we measure the health of the planet. To the extent by which we are breaching or violating what we call the planet's boundaries or the ecological ceiling. And right now, as you know, the Stockholm Resilience Center identified 9 planetary boundaries. You will see that there are sections or pieces of the pie that are already in orange, and that means those are the boundaries that have already been violated or breached, unfortunately. And in fact, this is not the most updated diagram, because I think it was late last year when a paper already announced or declared that the 6th boundary has already been violated. Do you know what it is? To our planetary health enthusiasts here monitoring the literature, freshwater use has already been violated as well, according to another group of scientists. So climate change, biosphere integrity, or biodiversity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. Land system change, we've been turning natural ecosystems into new cities, casinos, reclamated areas, etc. We mentioned freshwater use of rivers and lakes, because we're not just overusing them, we're also contaminating them. Biogeochemical flows of phosphorus and nitrogen resulting from our addiction to artificial fertilizers in the name of large-scale agriculture. And then novel entities, which we were also discussing a while ago in the meeting, because now, especially plastic, is in enormous amounts that the planet cannot anymore handle, right? And they're not just in the ocean. And unfortunately, there's a very recent report published last week that the largest ocean plastic pollution, or the largest contributor of ocean plastic pollution, is my country, the Philippines. We have 7,000 islands, and we're a plastic addicted country. And all the oceans and the seas around those islands are now filled with plastic, choking our fish and killing our coral reefs. So now this is like ocean health is now becoming a major issue in my country and in my part of the world. And of course, last year, you might have also seen that article from Dutch scientists saying they also have, we've not just violated the planet's boundary, plastic is already now found inside the bloodstream in human blood. So violated also the human body. So 6 out of 9 planetary boundaries already violated. And is life on Earth and the health and well-being of the population still possible, right? In this kind of scenario. This is really, I would believe, the grandest public health and planetary health challenge of our time. And so I always tell my students, if during COVID-19, we've been reminded constantly to flatten the curve of the pandemic, of infection, in order to not breach the health system's capacity, I think it's the same thing that we should be applying. We need to bend dramatically our ecological footprint, our carbon emissions, so that we do not violate, or even worsen the violation, because we already mentioned there are 6 already that are being violated, that we do not violate the Earth system's capacity or the planet's boundaries. But there is a major difference between the previous curve and this current curve. In the previous curve, the healthcare system's capacity can be elevated, can be moved, can be enhanced, buy more beds, purchase more medicines, recruit more nurses. So that can be expanded, while unfortunately the Earth's capacity, the planet's boundaries are constant, are fixed, are unchangeable, and therefore non-negotiable. The only thing that we can do is to truly bend our ecological curve. And then we heard a while ago, we also talked about the donut economy a bit. And we know that another grand challenge is how to make sure we do not violate the planet's boundaries while at the same time keeping our people on Earth healthy and happy. Okay, that's the basic, thesis of this concept. That's why this great economist, Kate Raworth, came up with this new model called the donut economy. Okay, an economy that does not violate the planet's boundaries, while at the same time ensures the provision of the health and well-being needs of society for all, not just for some. And certainly equity is central to this. And of course, this is going to be a challenge. And I think this is also a reminder for us in public health to start engaging with the other disciplines, the other sectors, the policy arenas, the economists. I would love to see departments of economics around the world to start really thinking about how we shift towards this kind of economy rather than perpetuating the current economic model that created the planetary health damages in the first place. And this is interesting. I'm not sure if you're familiar with this study by the University of Leeds. What they did is they attempted to answer the question, which of the countries in the world is closest to becoming like a donut economy? Okay? And usually I'll ask this as an exam question to my students. Choose your country. Which one is closest to the donut? A, the United States. B, Mexico. C, Filipinas. Or D, Vietnam. Okay? And of course, in these diagrams, in these donuts, the more reds, whether outside or inside, that means they're either violating the boundaries or they're having shortfalls in the social foundations of the donut economy: food, water, energy, health, housing, gender equality, etc. So just by eyeballing at these four donuts, you will know that both the United States and unfortunately Mexico have violated a lot of their planetary boundary budget. So each country has a budget. Beyond that, you have already violated the boundary allocated for you. Interestingly, my country, of course, we have environmental problems, but the Philippines so far has not violated any planetary boundary yet, according to this study. But you will see inside there are a lot of reds. And that means we still have to address a lot of the unfinished business of, human health, public health, social development, all these issues that affect, our citizens. And according to this study, the country that is closest to becoming a donut economy is a country 3 hours away by flight from Manila, and that is Vietnam. You will see that it has only violated minimally one boundary, which is the boundary for CO2 emissions, climate change. And they still have reds inside, but on track to really make it totally blue. So the question that we might want to ask is, how can we be like Vietnam? And of course, it's not an easy question to answer, because we also need to take into account different countries have different histories and different economies and different cultures. Vietnam is largely still a socialist country operating in a capitalist system. So there are questions, but these are what the numbers are saying according to this study. And right now, there is one city in the world that is now experimenting on realizing the donut economy, and that is the city of Amsterdam. Early on in the pandemic, they already made a pronouncement that moving forward, we will try to build the donut economy within our city. And as we speak, there are other cities in the world that are also starting to consider applying and adopting the donut economy. So that's the first part of my talk. I basically, presented some of the foundations of planetary health, some of the potential answers, Now I'll zoom into climate change and health, climate change being one of the boundaries. And in the succeeding slides, I'll share a bit about the situation in the Philippines in particular. The Philippines is a country that is unfortunately usually at the top 10 in terms of climate vulnerability, or risk indices. We know that climate change is going to affect human health in many different ways. You can see that in the diagram, many different arrows, many different pathways. And on your right, you will see that really there's no single disease group that is going to be immune to climate change. Infectious disease, check. Non-communicable disease, check. And even mental health, the health of our brains and hearts, will also be affected by the changing climate. And also, I think we need to remind ourselves, and a while ago we've been mentioning already equity. This is not just a health issue, this is an equity issue. Because as you can see, and this map is from the WHO, the countries that emitted the greatest amount of greenhouse gases into the atmosphere are not the same as the countries that will be bearing the brunt, that will be suffering the consequences of climate change and its health impacts. So you will see at the bottom, the parts of the world that will really be affected are Africa, huge swaths of Asia. Unfortunately, the Pacific Islands are too small here to be magnified in the map, if not totally erased from the face of the earth because of rapid sea level rise. And my region undoubtedly is a climate and health hotspot. Okay? So this is Southeast Asia, 10 countries, many of them are islands. And unfortunately in this map, the redder the country is, the more vulnerable the country is to climate change and its many impacts. And sadly, my home country, the Philippines, is the reddest of them all. So this is already a reality. This is not an issue that Filipinos will be addressing or witnessing 10 years from now. We're already experiencing it. And therefore, for the health sector, it's imperative for us to be addressing climate change and planetary health. So this is what happens when typhoons do strike. Typhoons is, the way we call hurricanes in Southeast Asia is typhoons. And when these typhoons do happen, this is their end result, right? Housing, farmlands, water systems, even hospitals and schools all being destroyed, populations being displaced, outbreaks, especially if water and foodborne diseases do happen. And over the past 2 years, or 3 years now, third year anniversary of the pandemic, we experienced firsthand the confluence between the COVID crisis on one hand and the climate crisis on the other. Imagine you are a poor Filipino living along the coastlines or along the corridor of the typhoon, and you are faced with a dilemma. On one hand, do I stay in the house to protect myself from COVID? But perhaps my house will be blown away by the strong wind, or the floor will be inundated by intense flooding. On the other hand, do I move to these cramped evacuation centers, safe from disaster? But as you can see, there's no social distancing or physical distancing to begin with in these places. And vaccine access is also, was very hard, especially at the start of the pandemic. And so it's easy to get COVID in these kinds of situations. So COVID or climate, what's your choice? But also, it's not just the extreme weather events like typhoons and flooding that we're experiencing now that we're trying to tackle. Heat is going to be a major issue in the Philippines in particular, but also in Asia in general. So these maps just show to you that in the coming decades, the region will continuously become warmer and warmer. And I'm not sure if you've heard of this new occupation or position that has been recently invented, the chief heat officer, right? And now some major cities in the world are appointing chief heat officers who will lead the design of resilience plans to heat, to make sure that the population can withstand a world of increasing temperature. The Philippines is also, unfortunately, I mentioned we have 7,000 islands. So there's a lot of coasts around the country. And unfortunately, we're facing some of the fastest rates of sea level rise in the world, around 5 times that of the global average. And sea level rise is also an under-examined public or even planetary health threat. You know, we've done a rapid review of the literature, and there are like only around 30 papers on this emerging threat of sea level rise, which can lead to, you know, initially seawater intrudes into freshwater systems. People start drinking water that is high in salt. And there's growing evidence, for example, in places like Bangladesh, that this is now a new way to get hypertension. So it's not anymore just food, salt from food. Now it could be salt from water because of sea level rise. Of course, you know, continuous sea level rise can also destroy farmlands, right? And many of the crops that we have right now are still not salt resistant. So this is where we can collaborate with the agricultural sector. And then, of course, when seawater continues to worsen, you know, or seawater intrusion continues to worsen even further, it can lead to mass displacement of populations. And in fact, our capital city, Manila, is expected to be totally underwater by 2050 if climate change is not going to be averted. And that will require, you know, massive transfer or relocation of millions of people, because Manila is one of the most populated cities in the world with a very high population density. And then, of course, because of the pandemic, you know, we've already heard and learned a lot about the inextricable linkage between the health of the planet and, you know, the risk for infectious disease transmission. And, you know, a lot of these infectious diseases are lurking around in nature, in the agricultural sector, in you know, in our forests, rainforests. The Philippines is one of the 21 mega biodiversity spots in the world, and also a major hotspot for wildlife trade. And so, you know, with all these ingredients, the likelihood of another zoonotic spillover happening is very high in our country, in our region. And even climate change itself is anticipated to drive these zoonotic spillovers. This is a very recent study published. And here in the map, you will see that the pinkest region, which is Southeast Asia, is where, you know, climate change is going to continuously worsen, and the viruses and the other pathogens are also, you know, highly likely to be jumping from one animal to another and eventually reaching human populations. So this really, you know, we're talking about ending this pandemic and preparing for future pandemics, and we can't do that while ignoring climate change and planetary health overall, okay? And unfortunately, even the ongoing negotiations now of the new pandemic treaty is still very light on this, you know, important areas, important drivers of emerging infectious diseases. Now, also food system, okay? And, you know, I know this is the expertise of the National Institute, among many others, but I'm just so amazed this morning listening to everything that you're doing to transform the food system of Mexico. Not just address obesity, but transform the food system to address what one Lancet Commission has described as the syndemic of obesity, undernutrition, climate change, all happening at the same time, all emanating from the same defective food system that we have globally. And just some idea of the state of nutrition or undernutrition in the Philippines: 3 out of 10 are stunted, of kids under 5. 9.2% of adolescents are overweight, obese. 28.8% of adults are overweight. 25% of pregnant mothers nutritionally at risk. So these are just some of the numbers that we're trying to tackle. And then now we have an extra challenge, because our food systems are not just an accomplice to the climate crisis because of the emissions, and also the broader planetary health crisis, use of pesticides, among others. But the food system is also vulnerable to the climate crisis. So it's a bidirectional relationship between food and climate change, which can then lead to enormous impacts in the human population, either under or over nutrition. So it's really a complex challenge, right? And then I already mentioned that climate change is not just a physical health issue, it's also a mental health issue. And now this is something that we in the Philippines are also really focusing on, investing in as a new arena for research and policy action. There was a 10-country cross-sectional survey that was done and published in 2021. You will see the bar graphs here. And what was found out was that the Filipino young people are the most climate anxious in the world. And no surprise, because of the impacts that I already described to you a while ago. The young people are now witnessing them firsthand, and are so concerned about what their adult life would look like, 10, 20, 30 years from now in an era of a warming planet. So this is an area, and we're starting a lot of projects on this area. And I'm a physician with a public health background, passionate about planetary health, but now I'm kind of forced to also learn about psychology and anthropology, and I'm working a lot with people from those disciplines because the climate and mental health nexus is a very social phenomenon that requires a transdisciplinary approach. So this climate activist was saying she feared drowning in her room, because she also experienced it firsthand, having her house being inundated during a typhoon. So I just described to you some of the major challenges that are affecting the health of people in my region, but I'm pretty sure this is a global issue. And unfortunately, the medical community continues to operate as if the global climate system is doing okay, right? Climate change and planetary health overall is far from being mainstreamed in the design of healthcare systems, in the way we conduct public health research, in the way we train the next generation of health professionals, and even in the way we address COVID-19, okay? Because we are a public health, global health system that did not put the health of the planet as part of our core, business. We ended up doing the response while creating new forms of pollution with the PPEs, the syringes, the masks, among others. It's never too late, though, because we're not yet done with this pandemic and more challenges are yet to come. So the question is, are we ready to build health systems that consider the climate? Are we ready to build a global health sector that is oriented towards and aligned with the principles of planetary health? So what I'm going to do now, I'll pause for a bit because I realize I've been talking already for the past, let's say, 30 minutes. And instead of adding or presenting more slides about the Philippines, I want to bring you to the Philippines by showing to you a short film. It's just 5 minutes. My doctoral dissertation at Harvard was half written and half in film. The written version until today has only been read by 3 people, and that's my doctoral committee. But the films have been viewed by tens of thousands of people from around the world. And I think the lesson also of the planetary health field is we need to start elevating the stories of the people who are affected in the front lines, but who are also fighting. They're not victims, they're victors in their own little way. So maybe we can show the film now, and I'll pause my throat, rest my throat.
Pagkakaunawa ko kasi sa climate change, gawa kasi siya ng tao.
Your regular climate behavior that you are anticipating, biglang nagbago. Kami, naranasan talaga namin yung impacts rin of climate change, which includes the sea level rise, may coral bleaching, may drought.
Dahil ito ay coastal areas, alam ba nila natataas yung level ng dagat? Kung uulan, mas matindi yung precipitation. Kung mag-init, mas prolonged period of drought.
May mga corals daw na siguro sa increase ng, di natin alam if sa temperature yan, nasisira.
Dahil sa sea level rise, yung mga bahay nila ay abot na yung mga sahig nila.
Dati, kung ganito lang yung kadami ng typhoon, ngayon iba na, mas madami na.
We were supposedly the first to be hit. We knew the mangroves will protect us. Kung bumagsak yun dito, sabi sa amin, based on simulation, 60% of us would have been gone.
If the problem mo will occur today as of this moment, parang hindi. Hindi, kasi marami kasi kami kakulangan. Ang pinaka ko talaga manpower, wala din kaming ECG, wala kaming CT scan, wala din kaming X-ray. As a doctor, ang malaking epekto ng climate change sa kalusugan ng mga tao.
Rampat, yung dengue, at saka yung amoeba.
Hindi ka nakasanayan yun sa mga tao na iniinom. So kung yun ang iinumin nila, mag-iba yung stomach nila.
Tayo ang gumagawa, tapos ang epekto, tayo din ang nag-harvest. Tayo ang gumagawa talaga ng sakit natin.
If your island community will become more inaccessible, how will you design a health system in that area? So what we did, accept na kada isang barangay, our communities, they have different health needs. And because they have different health needs, iba-iba yung approach mo.
Si healthy yung magko-complement kung paano maging malusog yung mga pamayanan pagdating ng climate change.
Your local health system has to really be climate adaptive. It has to be, because the changing climate will have new health challenges. And every new health challenge would require a new system, a new solution to resolve it. So it's evolving.
Pag sabihin natin climate smart, hindi siya madadaan kung gaano kayaman ng munisipyo, kundi ito ay madadaan kung paano ba maka-cope up si community sa mga impact ni climate change.
We thought initially it's all about infrastructures and systems. What we realized, it all boils down to basic values. How do we now translate values to become part of your systems and structures?
Mas better na mag-expend tayo ng millions of money for preparation, not for the response.
All of our multi-purpose centers can withstand up to typhoon signal number 4. To protect landslide, isisimento mo talaga yung road. So it becomes access to health, but it's a climate mitigation as well.
Ang food security, kahit walang dumating na mga goods galing sa ibang probinsya, kaya naming mabuhay.
We're also building one of the first climate field schools for farmers and fisher folks. Is to capacitate the farmer and the fisherman how to do it right if your climate is like this. Your communities, they know more than you do. Then your role becomes a facilitator. Allow them to develop a system that allows adaptation, innovation all the time. Kasi nagbabago yung sakit, depende sa klima mo.
Yung indigenous at science, pagsabayin mo dun, andun yung masasabi mong innovation.
How do you make the right decisions? Babalik at babalik ka sa science. Kaya, yun din isang ina-advocate namin, science-based governance. We now have data to make better and more informed decisions of how to change and adapt to reach our targets, our vision. The problem is, it changes all the time. We live in a world of uncertainty na eh. The only certain is that you have the capacity to address the uncertainty. The local government is at the forefront of climate change. The national government is so far away. If the drought happens next season, we simply go to the local government. That's the structure of our society.
Pag healthy yung environment mo, natural na healthy din yung mga tao. Pag ang mangrove management mo ay maayos, pag merong bagyo, merong storm source, yung mga tao ay maayos sila.
Their climate adaptability, which started from us understanding on yung vulnerabilities namin, to preparing survival, to now having quality of life. Just preparing for the future. Climate change was never a threat to us. Kesa katakutan mo siya, may wala siyang kakampi. That's why it's an opportunity to do something better.
Okay. And I hope it provided you with some idea on as to how local communities in the Philippines are trying to address many of the climate and health problems that I mentioned a while ago, and later during the open forum. I would love to hear your thoughts, as to what struck you the most when it comes to that film. So how do we build health systems that consider the climate? Okay? And some of the emerging ideas and frameworks that hope to address that question is, for example, this idea of climate smart healthcare, okay, or climate smart health systems. So climate smart is a concept that has already been used in other sectors: agriculture, climate smart agriculture, climate smart cities. It's just recently when we already have begun talking about climate smart health system. And what do we mean by a climate smart health system? So climate smart is the convergence between adaptation and mitigation, the convergence between sustainability and being green and lowering the carbon footprint, as well as adapting, rebuilding the resilience of the health system, making sure that the health system bends but not breaks, okay? That the health system is the last system standing when climate disasters strike. And I'll not go into the details. As you can see, there's so many different actions that health systems can do to build both resilience and at the same time lower its footprint. And it's interesting that universal healthcare is actually at the heart. Universal healthcare can actually be a vehicle for both climate mitigation and adaptation in the health sector. These are just some examples of hospitals in the Philippines that are now shifting to solar power, because we have now the hospitals are realizing we cannot be part of the climate crime. We cannot be emitting the carbon, worsening the climate crisis, making people sick, and then treating them inside the hospital, right? That just sounds antithetical to the healing mission of our sector. And I wonder if there are hospitals in Mexico already doing this. I was involved in this report. We tried to model what will happen if the global health sector does at least 7 actions that are listed here: shifting to renewable energy, addressing waste management, shifting to plant-based diets to be served to patients and to staff alike. What will happen? And actually, we can still keep on expanding universal healthcare and making sure that people have access to quality healthcare while at the same time not harming the planet. Okay? And of course, this is a modeling exercise at the global scale. The challenge is to actually realize it at the national level, to see national health systems retaining and even improving universal healthcare while at the same time reducing their ecological footprint. And of course, I mentioned that the other task of health systems now is building its resilience. Okay? That when a climate-related stress, let's say an outbreak, or an increase in infectious disease, or a shock like a typhoon, a hurricane, when these events do happen, that the health sector is still able to get up, stand up, recover, and even recover better than before, right? And not recover less, worse than before, or even collapse. Okay? And so these are some of the activities that we're doing with Philippine municipalities, because you heard in the film, the local government, the local health system is the first line of defense against climate change, in the same way that it's the first line of defense against a pandemic. So now we're working with local health systems to review their health plans and to incorporate climate smart measures. And at the same time, we're looking at their climate plans, because in the Philippines, every municipality is required to develop a local climate change action plan, which is very multisectoral. But what we're finding out is that the health sector is not very prominent in those plans. So we're now making sure that the health sector is an integral part of climate action at the local level. So we've been doing trainings, training the health workers on climate and health, looking at their plans, infrastructure, etc. You might have heard also of the concept of climate services for health. So climate services pertain to climate information, that are collected by the Weather Bureau, that are worked on by climate scientists. These are data sets that we in the health sector are not very familiar with. But now is the time to start engaging with the climatologists and the meteorologists and start thinking, how can we use climate information to make climate smart health decisions? So for example, this is my hometown in the Philippines, Ciudad de Calamba. And what I did with these climate hazard maps, I tried to look at, okay, what will be happening if climate change really becomes so worse? And what we found out is that all the hospitals in my town are in flood-prone areas. So in the future of healthcare systems, we need to do climate smart planning, right? The future hospitals and health facilities cannot be built anymore in those climate vulnerable areas. And we need to even start thinking of the stability of, the building materials, right? How to make them flood-prone, flood-proof, wind-proof, even salt-proof if they are along the coastlines at risk for sea level rise. Some people, including my medical students, ask me, what can we do if we decide to pursue a career in clinical medicine? We can even bring planetary health inside the clinic. It's not just a matter of public health, it's also should be part of the healing business of clinicians of the different specialties. I will not go into the details, but as you can see, the gastroenterologists, the emergency physicians, primary health care, and I even co-wrote an article, we should now be talking about planetary health care, right? As part of that primary health care. The family physicians have their declaration. So it's not just the core business of public health, the clinicians, the medical societies should be embracing planetary health as well. And if you're interested, there's this very interesting website of the New England Journal of Medicine, very interactive. You click on the organ system, and it will tell you how that organ system will be affected by climate change. A very good teaching material for physicians and other health professionals. And of course, I talk about the tasks that we need to do within the healthcare sector, but we need to work with all the other sectors as well. And of course, you're already doing that in the food front, and I'm sure you're also going to do that, and you're already doing that with transport, with the energy sector, with the industry, among others. And it's time to look for nexus approaches that tackle multiple problems at the same time. Because sadly, resources are scarce, limited, time is running up, and different sectors must also feel that they're winning, right? That it's win, 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 not only for health, but also for energy, environment, food, water, etc. And so this is an arena that I hope to investigate more in the years to come, because we've already been talking about social determinants for decades, right? And a lot of lip service to cross-sectoral collaboration, multi-sectoral collaboration, but it's so hard to do it, right? But now in the era of planetary health, I think we have no excuse. We just need to do it, and we need to find ways, better ways of working with other sectors. Okay, we already touched on the planetary health diet, which is, I think, one arena for those nexus approaches. I'll not go into the details, okay? And I just want to share to you that in Metro Manila, the capital city of the Philippines, there's now this growing movement on how to realize the planetary health diet as the core framework of our urban food system. Okay? And this year, the National Academy of Science and Technology of the Philippines launched a competition for entrepreneurs to find entrepreneurial solutions to the planetary health diet challenge. So that's another example. Yes, there's an academic work that needs to be done, but we don't have time, enough time to just do the research and the action later. They have to come together at the same time. So I'm reaching now the last part of my talk, the way forward, right? And I always tell my fellow Filipinos, if California has Silicon Valley, which is the epicenter of technological innovation, I would love to see the Philippines to become not the Silicon Valley, but the Silicon Islands of planetary health innovation. And for us to be able to do that, we need to build the infrastructure that will develop our capacity and really multiply our forces. And so one thing that we created is a national network called Planetary Health Philippines. So you can Google planetaryhealth.ph. That's a lot of PH, okay? And that's good branding. And you will see the many different faces and voices of planetary health in our country, okay? And there are people coming from different disciplines, different geographies, different cultures, different professions, different sectors, and different generations, because whether you're young or young at heart, you are part of planetary health. Of course, in St. Luke's Medical Center College of Medicine, the top academic medical center in the Philippines, we built this planetary and global health program. It's 3 years old already. We've been doing a lot of education, research, and outreach activities, from 0 person to now around 20. And we hope to grow this program, even further, and also to explore collaborations with different countries, including Mexico. So we're already collaborating with other countries, and we hope to add Mexico to our list of collaborators. Education is going to be central to the success of our planetary health movement. This is a framework that was developed by the Planetary Health Alliance, and I hope that the Institute is already part of the Planetary Health Alliance. If not yet, we'll definitely help you become part of our growing family. And the Alliance came up with this framework for planetary health education. I'll not go into the details, but as you can see, at the heart of planetary health education is this re-establishment of that broken interconnection within nature, not with nature. We're part of nature. That's what we always forget. So we need to restore that broken relationship. And really, it's all about instilling the positive values. And the technical work follows, right? And the other aspects of planetary health activity will then follow. So I encourage you, if you're considering to build planetary health education programs in the Institute or even in Mexico at large, this will be a very helpful framework. And we're doing that in the Philippines. We are trying to, and I mentioned this a while ago during our meeting, the 3 Ds of democratizing planetary health education, making it more accessible to other people, especially including those who cannot go to school. Decolonizing planetary health education. We can't just be transplanting an American syllabus to an Asian classroom. We need to develop our own body of knowledge using our case studies, etc., and then develop our own teachers as well. And digitalization should be taken advantage of. The Zoomification of post-COVID, quote unquote, education. And we hope that maybe in the near future, we can create a class, a planetary health class that is trans-Pacific, bringing students from Mexico and the Philippines together in one class Zoom, not classroom, okay, with teachers from both sides of the ocean. And it will be morning for you and night for us, or vice versa. We can, do it, what do you call this, alternately. And then we're actually building a consortium of 8 universities from 5 countries, Netherlands, Spain, Philippines, Indonesia, and Bangladesh, a consortium on planetary health education. And of course, we're open to having more participants from other parts of the world. It's originally an Asia-Europe consortium, but I will fight for the inclusion of Latin America. Last year, we held our certificate course for climate smart healthcare. We were educating hospital administrators, clinicians, public health leaders on how to make their healthcare institutions, again, climate smart, both resilient and low carbon. And we also just launched another collaboration with UMC Utrecht, where we will be similar to what I was describing a while ago, Dutch students and Filipino students learning together on planetary health and climate resilient health systems. So, and these are more of our activities, because what I'm also encouraging educators is that when we teach planetary health, it can't just be about the technical part. We have to develop the values and the leadership skills that I think are much more important, right? Because the planetary boundaries, that's Googleable, right? But the leadership skills need to be honed in real life. So now I'm reaching the end of my talk. And at the start of this pandemic, I saw this article by Arundhati Roy, a renowned Indian novelist. She once said that the pandemic is a portal, a gateway between one world and the next. Okay? And every time we go to a new place, right? When I was on my way from Manila to Mexico, I needed to know where I'm going to, right? Where's the destination, right? I need some source of information. So we need a compass, right? But of course, in the 21st century, no one uses a compass anymore. We use a Google map. So what is a Google map for the future? And I think planetary health is the Google map that we need towards a green, healthy, and just, quote unquote, post-COVID future. Okay? And actually, maybe you might remember at the start of the pandemic, everyone was so, yes, it's depressing, but also so optimistic. Oh, we're now moving to the new normal, right? A better future. There's a window of opportunity. But unfortunately, we've just returned to the old normal, which is abnormal. A true normal is a total shift, transition from this view of the world. Oh, the planet does not have limits. We can continuously consume and produce, limitlessly, infinitely. And instead, we need to shift towards the donut economy. Okay? An economy and a society that respects the planet's limits, protects the planet's integrity, while at the same time meeting the basic human needs of society, of the civilization. Okay? And this requires not just good quality research, but a renovation of the political economy that underpins planetary health. I also believe that planetary health is an invitation to planetary humility. It asks us to shift away from this ego-logical perspective. Oh, we human beings are at the top of the pyramid of nature. We can consume, mine, extract, kill, pollute, contaminate. Okay? Kill. And instead, we need to shift towards a truly ecological approach, where we human beings live in harmony, in solidarity, in greater interdependence with all creatures great and small, and all the other components of planet Earth are one and only home. And finally, I think planetary health is an invitation for us to become good ancestors. This is another fantastic book that we should all read. What we want is that by 2123, which is 100 years from now, the children of 2123 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2023, which is all of us in this room, have become good ancestors to them, because we made the right decisions, not just for our own health, but also for their health and well-being as well. Are we ready to be good ancestors and not to be selfish ancestors for these children and for the future children of Mexico, of the Philippines, and of the world who are yet to come? So together, let's advance the health of people and the planet. Muchas gracias. Thank you for this opportunity.
Thank you very much, Dr. Renzo. This is really great. Tendríamos unos 10 minutos para preguntas, entonces si gustan podemos captar 2 o 3 colaboraciones y luego volvemos con el doctor. Puede ser en inglés o en español y traducimos.
Thank you. Congratulations for your talk. It was fantastic and I think very useful for all of us. And what was shocking to me was when you mentioned that Philippines is like that you love plastics, that you are consumers of plastics, and you also live very in the front of the impacts of climate change because you are island. So what are the solutions that you are you are thinking to stop plastic? I mean, I guess when countries are able to ban plastics, there will be a domino effect, and then many countries will be able to do it. But I think someone needs to really take this seriously. I have seen, for example, in Mexico City, the plastic in the supermarkets are banned, and in other places it's voluntary. But have you seriously think and tried to ban plastic bottles?
Thank you so much. Great question. And certainly a difficult issue, you know. And as we know, also at the global level, there's a plastic treaty that is being negotiated under the auspices of UNEP. So hopefully that global framework will also provide guidance to countries on how to, you know, be emancipated from plastic addiction. But while we still don't have the treaty, there's a role for national and local action. And unfortunately, in the Philippines, because we're a decentralized, we have a decentralized governance system, right now, the banning of plastics and other options for plastic regulation are being, you know, the onus is put on local governments. So right now, if you know we have 7,000 islands, you will have pockets of good practices in an archipelago of failure in policy and practice. At the national level, there have been attempts, and there's a very strong civil society pushing for, you know, plastic ban, you know, the ban of plastic in many different arenas. But the lobbying of corporate sector is very strong. And, you know, we haven't mentioned it yet, but now there's a growing interest in examining, understanding, and addressing the commercial determinants, not just of human health, but also of planetary health. And I would argue, and actually I have an article coming up on that, you know, the commercial determinants of both human and planetary health are singular, and they're well connected, and they use the same tactics, and they have lots of money and power and influence. So now it means we need to, you know, if we're tackling, you know, the big food industry and you know, the breast milk company, infant formula milk companies and tobacco, we also need to work with those fighting fossil fuel and plastic industry and others, and pesticides, among others. So yeah, I hope I was able to answer the question. It's a struggle. Something's happening, not sufficient yet, but hopefully this very recent report will be a wake-up call for our politicians, most especially. Any others?
Thank you. I think your talk is really encouraging and it's giving us a lot of hope. I wonder, I was thinking in the same line with the last question about the resistance that when you propose a change, the resistance on the decision makers about, yeah, but the problem is that there is a lot of people who is reliant on these industries. So I wonder, when you talk about creating leadership, what are the processes that you exactly that you follow, or that you think that are like more or less effective about creating leadership among, for example, decision makers in governments and in the industry?
So what I'm getting is, your question is about basically leadership. How do we deal with lack of leadership? And you know, it's certainly an issue also here in the Philippines. You know, right now, we are under the regime of a former dictator's son. And which unfortunately has, we don't even know the agenda for health and environment. So it's definitely much more difficult. So when you have the top leadership missing, where else can we find, the leadership that we need? We're trying our best in the scientific community. I think we need to do much more, including the health sector. And that's what I've been trying to really galvanize, the health sector voice becoming much louder and clearer regarding these issues. Not easier said than done, of course. I am also looking to, and now I'm hesitating, when I say private sector, we just mentioned the commercial determinants and the private sector. Yes, we need to engage, but we need to engage in a very critical manner, right? And really make sure that we have the strength to combat, vested interests and self-serving interests and the tactics that they have. And then the leadership coming from communities. But this is also the sad reality. The communities are becoming more and more exhausted by each day. And unfortunately, we always put the burden on them. Oh, communities, you should be standing up against, right now, there's a very big issue around mining because communities are being wiped out in the name of mining. And some of the activists are also being sued, So now government and private sector utilizing law, weaponizing law in order to, kind of counter these acts of resistance. So I think, again, what I'm trying to say is leadership should come from all levels and spaces. Definitely, the top level leadership is so critical to this, and I think we have a global crisis of leadership for people and planet. Even in our big international institutions, the World Bank president just announced his resignation because he totally failed on the climate front. Hopefully, the next one will be a climate defender and from the global south. So yeah, I'm not. I hope I'm able to answer. I think I'm just giving to you a more, I guess, generic answer, right? Leadership is important. It should come from all spaces. We need to instill leadership in the young generation, but we need the good leadership also from the current generation who are already making the decisions, because time is running out. If we have a century, then we can wait for the young children who are planetary health citizens to assume leadership and affect the change. Unfortunately, this current generation will need to make the changes. Otherwise, this next generation will be suffering all the consequences of inaction and indecision. Hard question.
Just a brief comment, Renzo. Well, first of all, thank you for this wonderful presentation, a very inspiring presentation, and I hope that it was recorded. And then maybe we will request your permission to use it, for students, because, I remember when I first started being concerned about planetary health, but we didn't call it that way in 2010. Our discourse was telling people, if we don't change our behavior, we will start to have all these consequences. Today, the consequences are already there. I mean, you presented what is happening to Manila, what happened to Pakistan this year. The zoonotic spillover, we already had, had a pandemic. It is really amazing, how we are looking at the impact. And for example, in the past, we were saying, if we don't eat the right food, we are going to contaminate the environment. Today, what we are saying is climate change is going to reduce the production of food. We will not have enough food. I mean, it's amazing. And we don't understand as species. We don't understand. So it's very inspiring, and something that we have not done, and you have done it very well, is more social participation, more social movements. And the problem sometimes is that all of us have our own topics, but I think that this can be a topic that includes everything. And for example, I mean, in the food system, the syndemic, the way Swinburne and all the people, Simone and all those who participated, a syndemic of malnutrition, obesity, chronic diseases, and climate change. But, in almost every field, if you look at health systems, you talked about, the impact on health systems and the potential effect of health systems on the, resilience and environment. So those in my opinion, were really very, very powerful messages. And thank you very much. And I hope that during our lunch, we can talk about collaboration. Thank you very much.
Thank you so much. And, I'm very blessed to meet, especially the nutrition group today. I have so much to learn from what you're doing. But, and a while ago, you also presented how you're trying to bring planetary health to the different parts of the institute. I would love to also see the health systems people talking about climate change. How can climate smart features be incorporated in health system design, delivery, financing, health workforce planning? I'm actually a health policy and systems research person. I'm not an epidemiologist, but I think planetary health really requires the mobilization of our entire field and sector, and even beyond. And I'm really glad that you mentioned about the need to also go out there and really mobilize communities, civil society, which we're already doing, and the young people who are already leaders today, not just for tomorrow.
No, thanks so much, Renzo. This has been really incredible. We really appreciate your presentation. Besides this group here, we have over 30 people online. So you really raised a lot of interest, and I think you are like contributing to the implementation of this new paradigm of planetary health, which is really helpful. We're between you and lunch, so we don't want to hold you long here. Desgraciadamente estamos sobre el tiempo, entonces necesitamos cortar, pero por favor acompáñame con un aplauso para dar las gracias al doctor Renzo.